Assalamu alaikum and welcome to the sets of Frubs. We would like to have a brief introduction about yourself as doctors and in your personal lives.
Assalamu alaikum. I am Dr. Zainab Omer. I am a resident of ophthalmology at Mughal Eye Hospital, Lahore, and I am a mother of two.
Assalamu alaikum. I'm Dr. Rehma Shanze, third year resident at Mughal Eye Hospital, and I'm single.
I always liked the idea of doing something that actually matters, and medicine felt like a way to use what I'm good at and while also helping the people in a real way. And why ophthalmology? Well, to be honest, it was the least of the field that back then when I was a student, I never thought that I'm going to be in ophthalmology. And but Allah has His ways to put you into things that are best for you. And there was a time when I was really busy with my responsibilities. I could not do what I wanted to, and I had to take care of other things. And at the same time, I was really looking into something that to keep in touch with my field. And there I got a chance in ophthalmology. And I don't know, when I started liking the field and started to enjoy, and then there was no looking back. So yeah, then I decided that eye is the field for me. Back then when I was young, I got married. I was having kids. Meanwhile, I was looking after my ailing father. He was pretty sick. I did not have my siblings over here to help me out. So I was the only child. So these were the responsibilities. And while doing all of that, I did not have time to appear in any exam. So as you know, when we have to start for a residency, we have to appear in an entry exam. And that requires a lot of patience and time and your attention. So I did not have that leverage at that time. So I just randomly got a chance to enter into a field which is ophthalmology. I did not think over it. I just wanted to get into it so as to remain in touch with my field. And when I went into it, I really loved the field. It is ophthalmology is not just like a field like other fields that you treat the patients and they're happy. It happens in all of the fields. But what is most special about ophthalmology is that it is so rewarding when you're dealing with the surgical side, because a patient comes to you with having no vision. And in 10 to 15 minutes, you just give the vision to the patient, and the results are remarkable. And it is almost miraculous for a patient to have a vision back in 10 to 15 minutes. So I think I just really loved the idea, and it was really interesting. So there was no looking back. There are a lot of things expected out of a woman. People expect, to get married at the right age. If you don't, that is a problem. If you do, and you're not having kids, that is a problem. If you're having kids and neglecting your career for a while, that is a problem. Or if you're going for your career and not looking after your kids, that is also a problem. So there has to be a balance. And you always have a mom guilt. You're working, that the kids are behind, and you have that guilt. If you are looking after your kids, you're ignoring your career, then you have that guilt. So it is a race, obviously, and it is really hard for you to it all depends upon your choices, what you make your choices. Like I preferred to stay at home for a while when my kids were totally dependent upon me. Then when they started to go to school, so I thought that it might be a good time to give it a start at least. And I think it is. I don't think so. And even when we're dealing with the field itself, there is a struggle over there because people prefer male doctors. So being a woman into such field that which is very competent, it is not easy to compete with the males over there.
So my reason of becoming a doctor, her answer was very dramatic and it was very inspiring. Mine isn't. My father wanted me to be a doctor, so that's why I'm here.
A lot of parents do.
Yeah, exactly. So
that's a lot of pressure.
yeah, exactly. So I'm here for all of those kids who were forced into it. But later when I chose the field, that was all of my decision, and I fell in love with the field. I feel like you should be in a field that you genuinely enjoy, so you can give it 100% and you're honest to that field. I really enjoyed it because it's a very small organ, but there are a lot of problems in this. And again, as she said, that it really is rewarding, may it be a child or a elderly whatever the age group is, it's a very rewarding field for us. It's definitely a struggle, even if you're married or if you're single, and it's very intimidating whenever we hear their stories. Of course, medical field, it has always been demanding, so there have been several times where we would have to let go of any family event. You're studying, you have a shift going on, so there's definitely sacrifices in it. Females at the hospital, they told me that beta यहाँ की problems आपने दरवाजे पे hospital के छोड़ के घर जाना है, क्योंकि the patients are going to be yelling at you. Sometimes it's going to be a bit abusive as well. You just never know what's going to happen. So they told us कि सब छोड़ना है और घर वैसे ही जाना है, normal होके जाना है. So it was a very hard transition, but you do have to learn it.